a landmark coronavirus global response summit together with the European Commission President and a bunch of international partners. This pledging conference raised £6.5 billion in initial funding to kickstart global collaboration to combat COVID. Just a part of that was the UK's pledge, and that was only part of what the UK pledged, was £250 million for the Coalition for Epidemic Preparedness Initiative, or CEPI. It's quite a good organisation. That's money well spent. This summit responded to a call for action from the WHO and other global health organisations to support the development, production, and equitable supply of new COVID diagnostics, therapeutics, and the development of a vaccine. This really is a huge step in the right direction. But I tell you what, the good news doesn't stop there. It's really been a powerful week for global health. Just last Wednesday, the government also made a pledge of £330 million a year for the next 5 years to Gavi, the Vaccine Alliance. Now, you should have received an email from me welcoming that announcement. This is something we've been working very hard on for a long time now. We looked back at this in the office the other day and we think it's been almost 2 years. Many of you on this call have been involved on this and working on this since then and even longer. And you should take huge pride in your part of this hyperbolically amazing result. Look, the total funding figure was £1.65 billion over the 5 years, and that funding level is exactly what we asked for. And if I have to be honest, I had some pretty serious doubts that we'd be able to reach that goal, especially given the current challenges that we've got. But the UK has shown really strong leadership and has absolutely stepped up to the plate. But look, just forget the headline monetary figure for a second. The real importance of this is what it's going to achieve in the world. This commitment from the UK will help to immunise 75 million children and save 2 million lives. I just want to pause for a second. Can you just imagine how many people make up 2 million lives saved? I mean, it's 2 million people, obviously, but like, just try and imagine that for a minute. And then imagine the families of those 2 million people, mostly children, and the pain and loss that they will now be spared. I mean, can you even imagine it? The impact of that should absolutely stagger you because it is an absolutely staggering result. If you're anything like me, you should feel a bit overawed to have played a part in achieving that. I really hope that you do. So I just want to say so very, very, very big thank you to you all for the part that you played, however small, however large, in helping us achieve this. You really did help change the world for the better. Take a bow. If you ever need an example of what UK aid can achieve, this is it. It's exactly the kind of thing that countries like the UK have to continue to do, both because it's the right thing to do in our fight to overcome poverty and illness, but also because it's essential to develop the strong health infrastructure needed to help lower income countries become more resilient to diseases in the future.
Fine, lovely.
Now today, there's a media article in the publication politics.co.uk by Philippa Whitford MP. She's a SNP MP who's also the chair of the All-Party Parliamentary Group on Vaccines for All. She commends the government for all of these initiatives and for taking the international leadership role in relation to the COVID crisis. Now, we actually work very closely with Philippa Whitford, and like her, we're very pleased to see the UK take seriously our call for international collaboration to deal with the challenge of a disease that doesn't respect international borders. We're going to put a link to that really helpful piece into the chat box in just a second. I think these announcements are really just incredibly welcome. But COVID obviously creates a lot more challenges, not only to help keep people safe and build up health systems, but also in the shorter term to our ability to advocate for the things that we want to see achieved in the world. So we know, for example, that the Olympics this year, they were going to be a big moment for nutrition happening in Tokyo this summer. That's now not going to happen. It's been postponed. We're also hearing people say it might not even be able to happen in the summer of 2021. And we also know that the UN Climate Conference, which was to have happened this November, will now be postponed to either summer or autumn next year. That was going to be an important moment for our advocacy on health, nutrition, and education. So again, we need to find other opportunities to keep the pressure up. Lastly, I was interviewed by a journalist working for the development publication DevX last week and had a chance to talk about these challenges in not one, but 3 different articles. The first about the risk of a reduction of overall UK aid caused by a reduction in our gross national income or gross domestic product, a contraction of our economy caused by COVID. The second article, exactly on the Gavi Pledge, the importance of Gavi for building sustainable health systems, and thanking the government for their colossal and welcome pledge. And then lastly, on the danger of a sudden drop off in nutrition funding at the end of the year. We're going to be talking about all of that a bit more on the later tonight, but we're going to put the links in the chat box. You can have a look at them, and I hope that some of the articles and the quotes from me and from some of the other experts in the development sector are useful in developing your own language around the challenges of COVID, and you're able to take our campaign action this month. Look, that's all I'm going to say right now. We've got lots more stuff to get through, so I'm going to hand over to Della for the usual roundup of all your advocacy activities across the UK in the last month. Over to you, Della.
Thanks, Aaron. So I wanted to start with the April Grassroots action, which was to write letters to the state for Dyfed and Trevelyan, and encourage her to lead the UK's efforts to build stronger health systems around the world. I know a lot of the groups managed to collaborate on letters, which is amazing. I've heard from Manchester, Lithgow, Edinburgh, Poole, Macclesfield and London so far. The Brighton group have actually received a reply already from Claire Moran, who's the head of human development at Dyfed. And as Aaron touched on a little bit earlier, we're basically getting really strong indications that Dyfed are on side when it comes to maintaining focus on health system strengthening in the face of COVID-19, and that they're aware of the gravity of some of the long-term and secondary impacts that the pandemic is likely to have on the issues we work on. So really positive. And I think it sets us up really well for future more political grassroots actions, and helping Dyfed make the case with the government by continuing to show there's really strong public support for global collaboration and continued investment in strengthening health systems. So yeah, I will put a link in the chat box to a Google Doc where I've uploaded the letter, because we know that civil servants are really busy at the moment, so it's just in case you don't all get an individual response. It would be nice for you to be able to read that one, so I'll pop that in the chat box in a second. And I also wanted to ask if anyone wanted to share anything about the process of what it was like to write a group letter virtually, because I know you usually meet face to face, and because of social isolation you've had to collaborate via Zoom, which was a new experience for a lot of you. I think it's gone really well. Does anyone want to share and say how they found the process?
Hi. In the Manchester group, we found it really useful, because I know I, for one, am guilty of leaving it to the last minute, procrastinating the actions, you know, like 5 weeks after the call when I find my notepad. But we you know, the day after we had the call, we got together on our own call on Zoom, organised that for the first time, which is definitely something we'll be doing more of going ahead. And then we all got to break down different parts of it and have our own collaboration, which was also useful because we got to have ideas that we may not have had if we were doing it individually. And I think it's also good to not overwhelm the MPs as much at a time like this, so they just get one group letter.
Thanks, Hunter. That's awesome. I'm glad you found it a nice kind of learning curve and a good new experience. Anyone else want to share? No pressure.
Hi, can I share? This is Princess in the Pool group.
Yeah, sure.
With our group, it really just kind of came together organically. I think I really liked how it came together. Somebody sent an email to everyone, and other people just started adding bits, and we replied all, and people just added bits, and somebody said, oh, that looks good, that sounds good, that reads well, but you know, can we add this detail? I think this would make sense if we did that. And then I said, oh, we should end it with a nice closing by saying, you know, best of luck, hope you're keeping well. I just love the way it came together. We're not a very large group, but we are quite active and we normally get together. But on this occasion, we just circled emails and people just plugged in different parts of it. So I really appreciate the way our group did it, sort of organically, just added bits of what they thought would make sense.
That's really good. I read the final product and the letter was amazing. So it definitely worked well for you guys to just do it via email. So amazing. Thanks for all your efforts. I know Elena and Tamara from the Brighton group were busy writing a blog as well over the last few weeks, which is about doing advocacy online, considering we have a pandemic going on. I think Eleanor's on the call. Did you want to talk a bit about the blog? I'll post a link in the chat box as well so people can have a read.
Yeah, so similarly to what Hunter said, so we have our Brighton call normally a week after the main call. And then, so we have an ongoing blog, and Tamara came up with a few ideas about some blog posts she wanted to do. So we decided to collaborate on this one. So the way we went about that was having a Google Doc that we both could kind of edit. And then we sort of went, okay, so how are we going to approach this? Little introduction as to how advocacy has been affected by COVID, and then some like top tips on how to go about further advocacy now we're kind of all remote. And then we kind of just like wrote little notes to each other on like how we want to change things and certain things like that. And then, yeah, again, it naturally just kind of came together as a nice post. And then we just put it onto the WordPress and yeah.
It looks really good. I thought it was really motivating as well. And it's full of like really good tips about what you can do despite not meeting up physically. So yeah, do have a read. I'll just post that in the chat box now.
Okay.
Thanks, Eleanor. So a couple more things to mention. Last Thursday, I was involved in a training on UK aid with VSO and the One campaign, and it was really nice to see some results advocates join. There's loads of energy on the call and loads of really nice ideas of like how you can campaign on UK aid during lockdown. And some things that people were eager to try once lockdown is over as well. I can post a link to the slides if you want to have a little look and you weren't able to make it. And we've also sent a link of the recording to all the group leaders. So if you want to see that, just get in touch with your group leader. On a similar theme, registration has just opened for the international conference, which is organised by our colleagues from Results in the US. And it's going to be held on the 20th and 21st of June. It's a completely digital event now this year, which means you can attend for free and you can attend from home, so you don't have to fly all the way to Washington. If you follow the instructions in the link that I'll post, it says how you can register for free, or you can donate to Results in the US if you'd like to. We will let you know more details on like which sessions we think would be particularly interesting for the network over here. When we've got more details as well. Yeah, and I think the final thing I want to say is just keep letting me know when you've taken action or if you've received any more responses back from DFID or your MPs, and just thanks for everything you've been doing under really difficult circumstances. It's much appreciated. So yeah, back to you, Aaron.
Della, sorry, can I just say something?
Yeah, sure. Who's that? Sorry.
Emily.
Oh, hi.
Emily. I was involved in the pool action last month, despite living in Bristol. I just wanted to say that I have been one of those guilty people for the last few times I've joined the call, who join the call and don't take the action. And something about the current situation motivated me to take the action. It's just a thought in terms of how Results might actually be gaining new members during this time when people are more stuck at home and more wanting to do something proactive. So just a thought really for Results generally, either people on the call, how they engage with people who've fallen off lately, but also at a network level, it might be something to think about. That's all.
Thanks, Emily. We've still got adverts and things online, so we've still been getting some new inquiries from people that are finding us on volunteer sites, which is good. But yeah, there are definitely always new ways that we can try and engage people. So thank you.
Thanks, Stella. Thanks, Emily. So let's jump ahead to the topic of tonight's call. We'll start, as we usually do, by introducing our three speakers. They're each going to cover one of the health issue areas that we specialise in: tuberculosis, vaccinations, and nutrition. The first speaker is a good friend of mine for many years. Her name's Ingrid Schoeman. She's the operational manager for TB Proof. They're an amazing organisation and based out of South Africa. Ingrid was working as a dietitian in Port Elizabeth when she was diagnosed with XDR, extensively drug-resistant TB. That's one of the nastiest ones you can get. She was hospitalized for 75 days and the TB really changed her life. Today, she's a high-powered advocate with TB Proof. They're a TB advocacy organization that really puts the person at the center of the response, high-quality TB care for all. Ingrid's really passionate about the need to protect community health workers who are right at the risk of the pandemic. Is that sounding familiar to anybody? You could read a lot more about Ingrid on her blog on the MSF website. We're going to post that in the chat box in just a minute. So welcome, Ingrid. It's really good to have you. Second speaker we're going to have tonight is Bruce Reilly. He's actually the Polio Advocacy Officer at Results UK, so one of ours. Bruce leads on our advocacy on polio, and he's going to talk about the risks that COVID-19 poses to vaccination programs, which will include polio. Now, before joining Results UK, Bruce worked in the parliamentary team for the charity Versus Arthritis and on health and medical research issues for a political communication organisation. But since joining us, he's really been doing a bunch of great parliamentary work on vaccinations and polio. Our third speaker I don't think it needs any actual introduction, but I'll give him one anyway. It's Naveed Chaudhri. He's the head of campaigns here at Results, as well as leading on the support to the Results Grassroots network. The last year or so, he's also been working with other Results colleagues as part of ICAN UK. Now, ICAN is the International Coalition for Advocacy on Nutrition, and that coordinates advocacy for action on nutrition with the UK government. So he's going to be stepping in and talking to us a little bit about that. So thank you, all of you, for joining us as expert speakers tonight. Particular thank you to Ingrid. It's an hour ahead for her, so it's already 9:20 p.m. in South Africa. Ingrid, thanks so much for giving up your evening to talk to our network of volunteer advocates and campaigners. You can see they're from right across the UK, from Scotland to the South Coast. Some of them have been active on global poverty issues for many years, even decades. And some, as you would have heard at the beginning tonight, are brand new to Results. But of course, everybody on this call is keen to hear your experience of TB advocacy, and in particular, the additional risks posed by COVID. I'm going to now ask each of our speakers to introduce themselves and their role briefly, so we've got time for questions, but also just to say a couple of words about what got you into this work and what motivates you to do the important work that you do. Ingrid, do you want to go first? Is that okay?
Well, first I just want to say I really respect Results UK. Even when I just started as a TB survivor, I came to Aaron for pointers on how to be an advocate and how to go about it. Just basically my story was that I was treating patients with TB and suddenly I was the patient. And it just opened my eyes that TB causes a lot of suffering, even if you are well-resourced. So yeah, it taught me a lot of lessons, and I love my life as an advocate now.
Thanks, Ingrid. That's great. Everybody that finishes their introduction with "I love my life" is a really special thing to hear. Bruce, do you want to introduce yourself next? What gets you out of bed in the morning?
Hi everyone, it's great to be here. I've actually only been in Results since the later part of last year, so I'm sure that lots of this stuff I'm about to tell you, you can tell me a lot more. But as Aaron said, I've worked on health issues before joining Results. Most young people struggling to get access to really basic services and healthcare, and I think child health and vaccinations are a really stark example of this. It's a way of saving millions of lives, and in theory it should be really easy, but there's lots of challenges, and UK can play a really big role in this. So that's what keeps me doing what I'm doing. Thanks.
Thanks, Bruce. And now Naveed, if you could.
Yeah, hi everybody. So not everyone knows me. I've been with Results for probably about 4.5 years now, and it's my great privilege to help this network campaign on the issues that we work on. I suppose I've been involved within sort of campaigning on international development for a long time now, 20 odd years. I got involved in the early 90s with my local Oxfam volunteer group and kind of never looked back really. Quite early on, I remember getting in an argument with a then cabinet minister who was my MP. And I was absolutely scared to go and meet him, but I came out of the meeting, or we all came out of the meeting sort of half an hour later, and we'd sort of made our points. And I kind of thought, wow, you can do that. And for me, you know, getting people involved in the political process to make a difference has always been the one thing that I think is so critical to making change happen. So that's what drives me. And yeah, campaign on all sorts of different issues over the years, including trade justice, access to education, health, gender, climate change, lots of different things. But yeah, that's me.
Thanks, Naveed. Great intro. So look, we're going to jump straight into the pre-arranged questions tonight. We've got 2 questions for each of our 3 speakers. We have 34 minutes left on the call, so hopefully we'll be able to have plenty of time for questions from the floor. You can always put questions or comments in the chat box as we go. If you're on the telephone and can't see the chat box and you'd like to text in a question, the number tonight is 0777 56 11178. That's 0777 56 11178. I'll say that again before we get to that bit of the call. And also we'll always do the unmute yourself and yell out a question at some stage as well. But let's go straight across to Birmingham, I believe, who has the first question for Ingrid.
Hi, it's going to be me. My question is the COVID pandemic putting health workers in South Africa at risk?
Yes, it unfortunately is, especially frontline health workers or community health workers. So they are going out to households doing screening and contact tracing. And one of my colleagues is a community health worker, and she said to me, it's just heartbreaking. They're being sent out without masks or hand sanitizer, but because they're so committed to serve, they're continuing their work, but they're not receiving adequate training or PPE. Yeah.
That sounds incredibly difficult, Ingrid. I think we'll jump across to question 2, if that's okay, from Stort Valley.
Hi there. So I'll just show myself. Right. Okay. The question is, how is the COVID-19 pandemic changing the nature of TB treatment in South Africa right now?
There is synergy between TB and COVID-19. It's a lot of the same key population signs and symptoms. So there's kind of an opportunity and a risk. Like you could pick up more TB patients if they are coughing or having a fever, but at the moment the focus is on COVID. So they're falling through the cracks. On a more positive note, usually a mask is associated with stigma, and patients take off their masks and then spread TB in the community. But now in South Africa, our president made a guideline that you have to wear a cloth mask in public. And now people are creative and wearing nice masks, and the president, by mistake, put the mask on national television the wrong way over his eyes. And it was on the headlines, but he was joking around the next day, teasing with himself. But it's kind of changed the way that people view masks, and we think post-COVID, this will stay the same. Unfortunately, the one thing I'm a bit worried about is that they're giving TB patients medication for a long period of time. And people in South Africa are often quite poor, so they don't have cell phones or internet. So if they're missing a support group in person, there's no way for them to get support if they have side effects. So I don't know what's happening to them. And basically, for me, I've just realized again that we have to get patients with COVID and patients with TB to design our messaging, to make sure the content is appropriate and appealing, and kind of put all of our heads and hearts together in it, from civil society and the government side, because there isn't, now is not the time to not have a united front.
Oh my gosh. Thank you. I have got 2 more questions, but I'll maybe save them for later, or I could just post them now and you can carry on.
Post them in the chat, Pete, and we'll definitely come back to Ingrid. I think we definitely want to make sure that we get back to her expertise. But let's do the starter questions for each of the three speakers, and then we can jump in. Ingrid, thank you for that. I know there'll be loads more questions for you, but we're going to jump over to Bruce now. And I think London has the first question for Bruce.
Yeah, thanks, Aaron. Hi, Bruce. The question is, how is COVID-19 and how will it continue to affect the provision of vaccination services?
Oh, thanks, Richard. So the impact's pretty huge on other vaccine-preventable diseases like polio, measles, yellow fever, HPV. So obviously social distancing makes everything a lot harder, particularly routine immunisation with travel restrictions and the need to prioritise the health of communities and health workers. So immunisation tends to happen in two different ways, either mass door-to-door campaigns, which in most countries have been stopped because of social distancing and the need to protect kids and families from COVID spreading further. But it also happens in fixed settings like health centres and schools. And a lot of countries at the moment, they're continuing in some form, but this may change as lockdown procedures in those countries are better implemented or updated. Things like travel restrictions, so people might not even be able to get to schools and health centres. I know in Uganda, lockdown on public transport has reduced visits to some clinics by up to 60%. School closures mean that the buildings aren't physically open for vaccinations. And there's also big concerns about the supply of vaccines as well. So quite a big chunk of vaccines are transported across the world on commercial airlines, which have obviously stopped massively over the last few weeks. Also, some countries aren't accepting shipments from across the world. And there's real concerns that factories that actually produce these vaccines won't be able to produce enough because of staff not being able to come in. So yeah, big impacts and the chance that they'll only get worse over the short term as well.
Thanks, Bruce. Very challenging stuff. I want to double check. Is somebody in Manchester ready to ask the next question?
Yeah, hello, hi.
Whenever you're ready, Hunter.
Sorry, everything froze for a sec.
It's okay.
Thank you, everyone. So would it be better for vaccination programs to be stopped temporarily to provide resources to fight the more immediate risk of COVID-19?
Thanks, Hunter. It's a really difficult call, to be honest, and I think each country will have to take it as it comes based on the risks they face. So obviously stopping a lot of routine immunisation programs will halt the spread of the COVID pandemic, and also allows health resources to be diverted to the pandemic as well. So on polio, the area that I work on, almost all the global infrastructure on that, from community health workers to surveillance to things down to cars and motorbikes, are being diverted to help respond to COVID. But on the flip side, this puts at risk decades and decades of work to eradicate that disease and others. And there's a really good chance that we'll see a resurgence of those diseases. So I know in Niger at the moment, we've already seen a resurgence of a particular type of polio. During a previous outbreak of Ebola in Democratic Republic of Congo, the fact that lots of resources were diverted to respond to Ebola meant that twice as many people actually died from a measles outbreak. And I think what's really important is that whilst there's a kind of inevitable slowdown of routine immunisation services, that they continue where possible and that they come back stronger than ever, which is why it's so great to see the UK and lots of other countries pledging to Gavi so that these immunisation services can come back fighting fit. And also the GPI, the UK fund, made a huge pledge for that back in November. And also why this month's action really helps as well, so that people don't forget that these vaccine-preventable diseases are still out there, still harming children and families, and the world will need to continue to pay attention to them.
Thanks, Bruce. We are going to go over to Naveed to let him have a shot at answering a few nutrition questions. I think we are going to Sheffield for question number 5.
Hi. Does malnutrition affect someone's risk of catching COVID?
Thanks, Nicole. I think the basic answer is yes, but, and the but is quite important. So we've got very little data yet on how COVID affects people's bodies. It is, and how it kind of actually works. And there is evidence that it affects children, or children are less at risk than adults. And we think of children when we think of malnutrition typically, but it's kind of more complicated than that. I mean, I think firstly, malnutrition is by far and away the biggest risk factor for a lot of communicable diseases. So for TB, for pneumonia, and if you've got kind of reduced immune protection, you're very much more likely to be at risk from a whole range of things, and we can presume that that includes COVID as well. But it's not just about those children getting an immediate risk of the disease itself. The actual risks are actually quite a long way beyond that. So if you think that you had your immune system, compromised and your development compromised when you were a child, you are going to be more at risk from COVID. Now, whether you can trace that back to being, malnourished is whether that's going to appear in the data is kind of hard to say at this stage. But as we've already mentioned with the other kind of topics, it's those secondary effects that are really far and away the most risky. So we know that malnutrition is implicated in around about half of all child deaths under 5. And it's reckoned that probably, severe acute malnourished children, so severely wasted children, you've seen, the typical things you see on your TV screens, are probably 9 times, more likely to die than a properly nourished child. That's the figures that kind of we've seen. So it's inevitable that that's going to create a huge risks, not just from the disease itself, but all the other things that you're at risk from. And just thinking about how we've seen some really dire warnings from people like the head of the World Food Programme about, is quoted as calling it a potential famine of biblical proportions. Now, we don't think that that's an exaggeration. Apparently, they're looking at the doubling of the number of people at risk from food insecurity and acute hunger at the moment, which is from 135 million people at present, which is still a record, to something around 265 million. So that's a huge knock-on effect, and that's to do with things like, as we know here, people's, countries are shutting down, people's ability to earn a livelihood is reduced, markets are shutting down, good quality food is unavailable, supply chains are being affected, and unlike in our country, a lot of poorer countries just don't have the ability to help their citizens and their populations in those circumstances. So, there's this risk of a huge kind of looming food crisis. And of those figures I mentioned, over 80% of those people will be in Africa. And so that huge increase in poverty is just going to make a massive difference. There's different ways of kind of looking at what that risk is, but I've seen, potential estimate of maybe an additional 5 million children in danger of death from malnutrition, 7 million extra stunted children potentially because of the knock-on effects of COVID on access to food and adequate nutrition. So it's those longer effects rather than the disease itself potentially that's the really worrying thing.
Thanks, Naveed. That's sobering stuff. Last pre-prepared question is going to come from Edinburgh.
On mute. Hi, Naveed, what have you heard on the ground about how COVID is interfering with the delivery of nutrition programs?
Sorry, I was still muted. Thank you, Kathy. I think as Bruce, I think, was saying, it's kind of depends where you are and what you're talking about. I mean, every country is in a different situation. There's kind of three different, if you're talking about what kind of nutrition programs you're talking about, there's kind of three kind of main ones. So one of those is kind of food security programs. So the sorts of things where there's an emergency situation and people are going around actually delivering food, and hopefully nutritious food. Now, there's obviously not, as you can tell from my previous figures, there's not enough of that around anyway, and more of that is needed. And particularly that's going to be made more difficult because of things like the supply chain problems that Bruce mentioned. That affects you know, people getting food as well as it affects vaccines. And you know, obviously just doing that in a way that is keeping people safe when they're, you know, needing to go to somewhere and there's other people around, and both the people delivering, you know, nutrition support or food aid and the people needing it need to be able to do that safely. So there's kind of challenges to that kind of program, and obviously a lot of those are on hold, and people are really worried, particularly in you know, refugee camps. How do you deliver that kind of program safely, and how do you keep the food going in? So that's a real significant kind of effect. The second one is kind of what a second kind of intervention would be around social protection programs, as they're called. So a typical one would be something like cash transfers. So you're not in an emergency situation, but people are in longer term need of support. And obviously countries can't do that themselves. So typically these would be supported by donors, by international aid agencies. And, you know, again, it's a lot of those are pushed, a lot of those are suffering from funding problems. And so, again, those are being affected on the ground. And then the third type of a program is kind of health programs, and particularly primary care centres. And again, it's exactly the same kind of people that Ingrid and Bruce were talking about. They're people who are trying to deliver that healthcare, which people are just simply not going to because they're scared to go to them, or else the health workers have been moved directly onto the COVID response, or else you know, they're just unable to deliver that in a safe way. So in all of those different contexts, they're kind of quite a huge range of impacts on the nutrition programs themselves.
Thanks, Naveed. There is a vast amount of stuff to unpack here around COVID and the way that it's affecting tuberculosis, nutrition, and vaccinations. I'm going to take Chair's prerogative and cherry pick out of the chat and try and clump some things together so that we can get through as much as we can in the last 15 minutes. I had a really good question that came in while Ingrid was speaking. Ingrid, I'm going to start with you, so get your pen ready. There'll be a few things coming at you. One is around how does inequality in South Africa affect access to healthcare and access to needs like tuberculosis, and do you see those same inequalities playing out with COVID? I think we also had, hang on, what else is happening with the chat? There's loads going on here. Sorry, I saw there was another one in there. Where?
There was a good one, I think, from Pete on what's the most important thing that we can learn from TB treatment in the COVID situation. Yeah, and then a third one as well. And Ingrid, I don't know if you know the answer to this, but you might have seen it. How much is the compromised immune systems of TB HIV patients making them extra vulnerable to COVID? And you know, I've been reading the literature, and I don't know the answer to that question. I don't think there's an official answer, but there is, I think, quite a practical one, which I'm sure you've seen for yourself. And actually, while you answer those, I will also say that I was on a call the other day with somebody from the South African Health Ministry who showed the number of TB tests that are going on at the minute. Have you seen that slide? It's rather. Do you want me to put that on the screen while you talk? Would that be okay?
Oh, if you, yeah.
Okay,
right.
I'll put it on the screen while you talk.
Okay. So even before COVID, inequality is a big issue in South Africa. When I go to the doctor, I go to a private doctor, I get seen immediately, I make an appointment. When someone in public sector goes, they go before sunrise, they sit in the queue the whole day to get a number, and then the next day they use that number to get in. So already a patient has to take off 2 days from work. and sit there waiting for treatment. Now, employees can't give a person off 2 days a month, and people don't want to lose their income of 2 days because they live off that money and their family as well. So inequality is already an issue, but now what my friend living in a informal settlement, or in a shack as we call them, she said to me, the problem isn't ignorance, people walking around and having parties and drinking in the COVID-19. It's not ignorance, it's a lack of access, because they don't have electricity, so they don't hear about COVID on the radio. And I think there the onus is on the government to make sure that they go into, make sure that people understand what it is about. Because it's easy for us to criticize from the outside, but if you've never lived there without electricity and you can't read, how must you understand this disease? Something I think other countries could learn from South Africa is that our presidency and our National Department of Health have a team of about 50 experts of epidemiologists. So each decision that they make is informed by international advisors and science-based. So it's not their own opinion or belief system or political view that makes the decisions, but it's based on science and lived experiences. So I think South Africa's done well with that. And they also have the same advisors sharing consistent messaging, but at a community level, so that people could understand. For compromised immune system patients, I think I saw a slide today. Aaron, please feel free to also add your opinion in here, but I saw a slide today from the Western Cape and Cape Town area. Despite lockdown, that we're still going to hit our peak. So that just shows it's difficult if you're living in overcrowded households with a lack of food. Someone has HIV, or a couple of people have HIV or diabetes or immune compromising conditions. I myself have ulcerative colitis. But now if you're all living together, and then you can't do physical distancing, you don't have money for clothes, let alone for masks. So I think inequality comes back in again with immune compromised patients, maybe not wanting to go to a clinic to get tested for TB because they're scared of coronavirus. And the gene expert test that's being used to diagnose is moving away from TB, but because the focus now is unfortunately on COVID. Yeah.
So,
Aaron, please also add your thoughts on this.
well, sure. I mean, just to build on what you said, Ingrid, for those that don't know, what we're seeing on the screen, these are the gene expert tests that Ingrid was just talking about. These are the kind of the gold standard, the best frontline test that we can currently give. And South Africa has invested very heavily in these machines. And what you're seeing is that around the middle of March, as social distancing and lockdown kicked in South Africa, the number of tests has dropped dramatically. You'll see the detection rate is going up, that figure of 9.4 and 11.6%. And that basically means that's because only the sickest people are brave enough to go to the clinics and get tested. That's my interpretation of that anyway. I asked the gentleman from the Ministry of South Africa what his explanation was for these figures, and he said the biggest thing is that people aren't going to clinics anymore. He said it was that people were ill but not going to get tested, which of course you know, is a real problem. And I think it speaks, you know, again very strongly to these questions of inequality that Ingrid was talking about as well, and people needing to prioritize other things and buckle down. And we see that on the same way here in the UK, with lots of people putting off routine or normal activities that they would normally undertake for their health because they don't want to risk exposure to COVID. I tell you what, we have 10 minutes left. I want to give some questions on some other topics around as well. There was a good question for Bruce. Where was it? There's so many questions in here. I think it was from Emily. Where's it gone? Here we go. So Bruce, are there some positives? With Ebola, we learned that some countries did better because of the detection infrastructure put in place for polio, you know, the surveillance infrastructure there. And then also, you know, like, do you know, and this is a UK-based question, so I'm not sure you know the answer, but do you know what's happening with routine immunisations in the UK, or is that predominantly a developing country problem, if you happen to know the answer? But if you could maybe speak to some of that, that'd be great.
Sure, yeah. I suppose in some ways there are some small positives, and actually, Emily, the example you gave of Ebola and polio working well together was the one I was going to give anyway. So because the polio infrastructure across the world, the Global Polio Eradication Initiative, has so much expertise and capacity in so many countries, that previous outbreaks we've learned that the staff, the resources, the labs, the vehicles, everything can really help respond to different outbreaks. So historically, the Global Polio Eradication Initiative has just been so focused on eradicating polio, or kind of operating vertically, to use management speak. But previous outbreaks like Ebola have meant they've had to work together better with organizations like Gavi, pool their resources, pool their expertise, so that they can respond to both. Also on polio, the GPI, the Global Polio Eradication Initiative, has requested that the fact there's going to be a pause in these immunisation activities, they've requested that each country programme takes a look at what can be improved in their own polio immunisation plans, given that there were serious challenges remaining in eradicating the final cases. This might give a bit of breathing space, I hope. So there's some small positives. On the UK specific picture, I don't think it'll be impacted as much because we're not as reliant on door-to-door campaigns, but I know people are putting off going to the GP, going to hospital, interacting with other health services. And the UK was already starting to lose its high immunisation rates. I think we lost our WHO measles-free status last year. So on the UK picture, it was dipping slightly already. I can only imagine it will have the same effect. Thanks.
Thanks, Bruce. We've got some questions in here around CEPI. Hang on, where is it? Sorry, too much scroll. You guys have asked way too many questions this time. Sorry, I thought I had this one. I think it's because people keep typing and they jump around all over the place is the problem. Naveed, can you see this question on CEPI, or anybody? Where is it?
Is it the one about how the extra funds given to CEPI from Hunter?
Yeah, that's the one.
So as far as I'm aware, CEPI is only about developing a new vaccine. It's, someone may correct me there, but it's organizations like Gavi and GPI which support those wider health services that helps countries respond to COVID and deliver the vaccine. I hope that helps a bit.
I think that does, Bruce. I mean, maybe just flesh that out a little bit. I mean, getting a vaccine developed is only one stage. You have to have a vaccine in the first place. And this is where you can see many of that's one end of the research development pipeline. Once we get it, and this is what really the pledging conference yesterday was all about, a big chunk of the 6 point whatever it was billion pledged yesterday was all about making sure that we had the money to develop vaccines, tools, and diagnostics that we need for COVID. But once we've got it, what do we do? And that's where Gavi comes in. And I think that's why the other UK funding announcement last week on funding for Gavi was so important and so complementary, because Gavi is going to be an absolute lifeline in terms of taking whatever new vaccine we do get a year or 2 years from now, I wouldn't want to guess exactly, and then making sure that rolls out to billions of people as quickly as possible. We will not be able to do that without Gavi. So these two funding announcements in the last week that I talked about at the start of the call are so very, very complementary, very smart investment from the UK government. We have had no questions come in from the phones that I can see. So if you did send any in, I apologize, I've missed it, but I've triple checked and I think we're okay there. We've got 5 minutes left, and I think we've had lots of stuff in the chat about how things, ethnic minorities and Black and minority ethnic populations in the UK have been adversely affected by COVID. And also looking at the relationship between levels of poverty and COVID. And I think there is, I think I want to say a couple of things pretty briefly around that. It's not that we don't want to address it. That's not really results area of expertise. And I think we'd just be guessing if we were trying to answer some of the questions around that. But if I had to hazard a guess, I think you will, if you were to slice the number of the populations that have higher rates of COVID versus socioeconomic status, I think you'd also see quite a strong correlation there, because like a lot of things, when you're talking about public health, it's always people that are finding themselves subject to the wrong end of inequality that always bear the brunt of these things. And we see this over and over again. And I think what we're seeing playing out in the UK, by the time we get around to doing the final analysis around that, I think we'll see a very strong relationship between poverty and deprivation and effectiveness, and how much different communities are affected by COVID, the same way we're seeing in every country in the world. And you know, I think that's about all at this stage we can say these at this point. I'm just we've got 3 minutes left, and we haven't gone to anybody to yell out a question. So if you want to yell out a question, or you've got a burning question that you put in the chat that I haven't read, I'm going to shut up for a second, unpause yourself and say your name.
That's Mark here in Norwich.
Go ahead, Mark. You've got the honour of the last question. Make it a good one.
Thank you. It's more a statement, really. Was it on tonight's call? Big respect to all the speakers, looking at all the aspects of what we've seen coming for many years. Do you think, was it to the speakers, that possibly out of this, in maybe sort of 18 months' time, was it we might be in a better place to evaluate and make sure that health systems are a higher priority than they are at the moment?
Thanks, Mark. That's a really great question. Does any member of our panel want to tackle that?
I can kind of speak about my role. So I work a lot with MPs, trying to get them interested and care about our issues. I think, yeah, it's certainly for my role, it's focused so much attention on global health and need to fund life-saving immunisations that hopefully the government will just pay more and more attention to it. So I hope that helps a little bit. I'm optimistic in that sense.
I think in South Africa, the health budget for TB, HIV and malaria, for TB, it's less than 0.2%. And I think after the pandemic, there will be more money for infectious diseases. And that makes me happy, because TB is the leading cause of death in South Africa. So if they give more money post-COVID, lives will be saved for TB as well in future. So I hope so.
Thanks, Ingrid.
Can I just add very quickly, I kind of agree with Bruce that this is a time when we'll never have as much focus on global health again, and I hope that will galvanise people's minds to the absolute reality of the need for strengthened health systems around the world. But on the other hand, there is, you know, this forecasted huge global recession that's going to come out of this, and therefore, you know, there's going to be that could potentially have a knock-on effect on our aid budgets and really increase our need to advocate for, you know, us to spend our aid budget wisely and on the health outcomes that we really want to see. So I think it's not a done deal one way or the other. We've got to really push for that positive side to come out.
Thanks, Naveed. That's a great way to sum up. And I think, you know, that's something that all of you are so very good at, and hopefully even those of you that are new, you can see and you will see how we can help equip you to do a really good job at all of that stuff. There are fewer times better than now. I think we have some interesting messaging to navigate, but attention is certainly focused on global health. We are bang on the hour, so we have come to the end of our time together tonight on this call. Really want to say a massive thank you to all of our speakers for sharing their knowledge of COVID and how it's affecting their issue areas, especially Ingrid for staying up so late. It really should have become clear by now. This is a very fluid and fast-moving situation. There's relatively little data about what's actually happening in many cases and how the disease is going to impact people. Every country's making different choices. Every choice leads to different sets of outcomes. Modifications are being made to health systems all over the place. We're going to have to remain really nimble to carry on advocating in a relative way. And I can reassure you that, as always, we're going to do everything we can to keep you informed about all the latest developments. Thank you, as always, for sharing your time, giving some energy to these subjects, taking action with us, and really the responses that you get back from parliamentarians, from civil servants, from all of the people that you interact with, even from the media. All of that feedback is just hugely invaluable. I really hope it's been a bit more useful to go into a little bit more detail on each issue area so that you can feel more confident on what's happening in health overall. So you've got a little bit more ammunition when you write media articles on the importance of an international response. For most publications, you're not going to need a very high level of detail, but we know that most of you also want to understand these complexities and feel really confident that you know your stuff. So the action materials that were emailed to you all on Friday, there's guidance on how to distill these complex topics down into bite-sized chunks of media so that the public that doesn't know about any of these things can still digest them pretty easily. That skill, being able to digest stuff down and focus it in, is absolutely as important as actually knowing all the detailed stuff in the first place. Thank you in advance for all you can do to help gain that political support for the good work DFID is doing to address the global poverty implications of the COVID pandemic. We need those positive stories more than ever. Really looking forward to seeing you all on the next Grassroots conference call. It's going to be on the evening of Tuesday, the 2nd of June, same time, maybe even the same Zoom link. We will have to see. Big thank you for joining me. Big thank you for your work on Gavi. Remember, 2 million lives, don't forget that. Good night for me, and I really hope you enjoy the rest of your evenings. Thanks so much, everybody.
Bye, everyone. Thank you.
Good night, everyone.
Good night. Thank you.
Thanks.
Bye.
Bye. Thank you.
Bye.